Good morning. Hello, I'm Dr. Rahman, Ataur Rahman Khan, in fact. I hope you guys are doing well. Today I am going to talk about an important subject which we call osteoarthritis, rheumatic disease. There are more than 100 rheumatic diseases existing in the world population. What is rheumatic diseases? Rheumatic disease is inflammatory and non-inflammatory disease. Autoimmune disease such as rheumatic fever, rheumatoid arthritis, systemic lupus, erythematosus, and so forth. Osteoarthritis is a common disease which is present especially in the older people, postmenopausal women, and it is present all across the globe. Millions of people have been suffering from osteoarthritis and disability. Osteoarthritis is developed gradually due to the wear and tear of your joint. Your normal joint has a cartilage in between. There is a wear and tear and destruction of cartilage in course of time. When there is a mechanical stress present on the joint, then there is a tear in the cartilage. For example, you have ice cube in the refrigerator. You are bringing down the ice cube on the table. Sometime you thought that let's see how so you broke the ice cube. When you broke the ice cube, it becomes a rough surface. Like in your joint, there is a ice cube which we call, for example, you have knee joint, you have some ice cube there in between your long bone, femur, and below tibia and fibula. And this ice cube is abraded or broken or fragmented. Then what happened? Then your joint surface become rough. There was a smooth friction between your joints, between your bones, so that you can have a smooth locomotion and movement every day in your life. But when there is a wear and tear, like an ice cube is broken or torn, then the surface become rough and you have some inflammation, you have some pain, and you have some kind of limited range of motion. Therefore, you have the pain. Osteoarthritis is present in almost all joints in the body, especially in your cervical spine and lower back. It is also present in hip joints and knee joints. Those who are overweight, those who have a family history of osteoarthritis, they may have more of osteoarthritis. Those who have injured their knees or ankle or hip in the first due to the sports or accident, they are more prone to have osteoarthritis in that particular joint. Those who have a disordered joint during their birth, like joint is deformed, then there is a risk of osteoarthritis. Those who smoke, those who have diabetes, those who are overweight, those who have a mechanical stress on their joints due to the job, those who have to do a lot of walking or running or a lot of movement in the joint, they are more prone to have osteoarthritis. That doesn't mean that you have to stop walking and running. Walking and running and exercise is good for the joints because it will tighten, it will promote the blood supply of the joint, and it will increase the muscle tones around the joint. I want to show you some pictures. Let us see the pictures here. This is knee joint, a hip joint, and it is a normal surface. And when you look at it, it's an abraded and it doesn't have the normal surface. There is some destruction of the cartilage, so it is exposed to the bone, so it is more painful. You see the joint space in the hand become narrowed because of destruction of the cartilage. Narrowed, you see narrowed joint, space due to the destruction. When this is not narrowed, this side is narrowed. You see, there is some abrasion of the cartilage and some ulceration of the cartilage. And this is so important that you know what to do. You have to lose weight, you have to do some exercise, you have to control your diet, you have to control your diabetes, and also do not smoke. Please remember that if you maintain your healthy lifestyle, you cannot prevent totally osteoarthritis or degenerative joint disease. However, you will be better off to do that because you can have toleration in the joint pain if there is one. Thank you so much for watching. I will see you soon. Thank you.